Well, good morning, everybody. We are back on Dental Tech Chats with Dr. Ambridge, and I just wanted to have her start off by giving a little introduction to what she does here at her practice. And thank you so much for joining us on our podcast today.
Hi, so I've got a practice in Arizona, and for us, technology is a really big deal. We use a variety of different technological tools to interest patients and to wow them in doing different treatments.
Wonderful. Well, I want to start off then with your treatments and ask you kind of about like your diamond in the rough products. So like what product you buy that you see no one maybe possibly uses in their office that's been a big advantage to your practice.
So I think the biggest thing, like the diamond in the rough, I would say it's using photography. So we actually have a studio in the practice. So we have a professional studio. We have a room that is doing that. And we're using photography to, first of all, get all the records, so communicate with the patient what's going on and what the concerns are. So they're really impressed with that because we have really nice records that show them their condition, so we can discuss that properly. And also we've been doing photo shoots for patients. So after they've done treatment, I can get a makeup artist coming in if the patient's interested, obviously, and we'll do a fashion shoot. So that was really cool for patients, and I don't think that many dentists are doing that.
Yeah, I don't think so either. I think it was really neat that you've added that into your practice. I actually saw that on your Instagram. That's what kind of lured me in to see, like, hear about your technology. And I went onto your website and kind of read some things. So thanks for sharing that. When you do your pictures, what camera are you using? Just for like other doctors and dentists out there that are wanting to possibly get started into doing that.
I have a Canon 6D, but I think, it doesn't necessarily matter what camera you use as long as it's a DSLR. There's a lot of different options on the market, but that's the one I like. You have to have the light setup and the correct lens. There's a lot of courses as well available on photography to learn how to do that, but that's the one I use, basically.
Well, thank you for sharing. Yeah, the pictures you take are just beautiful of your patient's teeth. I really like some of their images. Like I've seen like one of your like people who had their braces and she had took those off, and I really liked that image. It was really pretty. And then I wanted to ask you also, the next question is like, are no risk, no reward. So like what was a big investment of time or money in technology that was a big payoff for you?
I really love my intraoral scanner.
Okay.
So, they are an investment for sure. And we've started scanning everybody who's coming in. So when they're coming in for their cleaning, their first exam, we're trying to do a scan of their teeth. And, it's not just about sending things digitally and not having to use UPS or whatever to send out cases. It's been a really great communication tool for patients because they're watching their scan being taken, they're seeing their teeth, they can see their inflammation, their calculus, and then they're a lot more motivated to start dental treatment because they see their teeth like we see. I think that's a big deal.
Yeah, I think that's really what's going to help with like that patient education too. Like you said, if they can see what you're seeing, it's been really a big manner of like why technology feel is important. And if you don't mind me asking what type of scanner you're using in your practice, just so for other dentists, if they wanted to know like what type of tool you're using.
Yeah, I have the Carestream 3600.
Okay. And that does a pretty good job with when you're mapping the mouth, you get like each patient information chart. Okay.
Wonderful. Yeah, it does a great job, and it's full color. I know there's a lot of different options on the market, but it's one that I liked in terms of kind of price quality standpoint.
Yeah, I totally understand that. It's definitely would just want to hear it for them if they're not using one, just kind of let them know what you've been up to and using. And then I also wanted to ask you on like the flop. So it's kind of the product that you buy into, it might have been like a waste of time and money for you. Like you thought it was going to be something you were going to use and it was like, oh, I didn't actually get to use this as much as I thought. So you have like any products like that?
Yeah. So when we first started the office, I bought a towel warmer. So it's like a little heater for towels. And, we were going to have staff hand them out to patients after treatments or after especially longer treatments for their TMJ. And I think it's a good idea still, but it's been really hard getting staff to actually remember to
hand the
offer
towels.
the towels. So, you know, not everybody wants, patients sometimes are confused kind of what to do with the towels. So, you know, that's probably the biggest flop because we don't really use it very much. I mean, I'm still going to work on it, but
Yeah. I think that's pretty neat. I mean, the, you know, experience is everything, you know, sometimes they don't always remember what you're doing in their mouth, but they'll always remember like the feeling. And I think I also was like reading some of like your information, and you guys have like the splat screens and stuff like
Mhm.
that for patient experience. I think it's definitely important. And then I just kind of want to ask you about like your dental like fluent like influence. So like when it comes to like when you're promoting your products, like how do you kind of educate your patients on the technology you're using in your practice?
I mean, we just offer them things, so I don't know if we
Okay.
really explain it. I mean, I guess we do. For example, for the intraoral scanner, we tell them it's, you know, it's going to take thousands of pictures and it's going to mesh it into a 3D rendering of your mouth, and
Hmm.
it also helps keep track of different conditions so we can see if recessions are changing or if things are changing. You know, we can look at their bite. So we explain what it does and why it's good for them, like CBCT, you know, for using it for implants. You know, we
Right.
can really make sure that we avoid complications, like we don't, you know, where your nerves are and where these different things are. So that's really, you know, we just explain what the benefit is to them.
Right. I think it's very helpful just to kind of, like you said, explain to them like the benefit with using that technology. Because I feel like sometimes patients don't always know like these fancy terms, and it kind of helps break down like what this product is doing to help benefit their diagnoses for understanding what's going on in their mouth. And then I
Mhm.
just kind of want to ask you, just like kind of before we wrap everything up, just kind of ask you how long you've kind of been practicing, and what's your favorite thing about, you know, helping your patients, and what got you to start your practice?
So I've been practicing for about 5 years. You know, I moved to Arizona fairly recently from Canada, only about a year and
Okay.
a half ago. So that's pretty exciting. And you know, I started my practice here. You know, my main interest is cosmetic dentistry. So I really love
Hmm.
doing cosmetic dentistry and orthodontics, and joining those two together. And I feel like in my new kind of I kind of need to have a practice of my own to be able to do that to the full extent that I want to, because there's so many different supplies that I need to be able to do it properly. And I also feel like, you know, certain environments, like a corporate environment, they won't let you really take your time to do those type of things. So
Oh.
that's why, you know, I felt like having my own practice was the only option to do the dentistry that I wanted to do.
And what kind of like moved you to Arizona? So you said like you left Canada because you wanted to do your own practicing. So that's amazing. And I kind of read too that you are really into like art. Did you ever get any
Mhm.
of this art into your practice?
I do. So I have my photography, so I've printed it on canvas and I've
Great.
hung it up onto the walls here, and that's pretty cool because, you know, first of all, I get to, when I'm designing the office, I get to make sure everything matches in terms of
Right.
the colors. So I really plan the imagery. And I've been working on some oil paintings as well for the office. So, you know,
Very
that
neat.
allows me to, you know, bring my own creative side and add it like a little touch, you know, that's pretty cool to the office, like a personal touch, but it also all looks modern and looks like it matches the actual office. So I think that's really important for me. So I'm still
Yeah.
showing personality, but it's not, you know, too much. It still kind of looks like it works, like kind of minimalist together.
Yeah, I was about to say, I really like the aesthetic. It's very bright and happy. And like you said,
Hmm.
I really liked like the orange. I saw that was a lot, like orange and white
Yeah.
was like, is like one of your favorite colors by chance?
I don't know. I don't know. I don't really think I have a favorite color.
Oh,
Maybe
okay.
white, but
Okay.
I just, you
It's
know, I
clean.
just felt like having a pop of color, and orange seemed to be it. Kind
Yeah,
of like a.
I really love it. I mean, even in your background right now, it looks really nice and really
Mhm.
pleasing. So I just want to say thank you so much for coming on Dental Tech Chat with us today. It was really nice to learn about some products you've been using in your practice and sharing with all of us here today. And thank you again for stopping on.
All right. Well, thanks.